A town of 1,500 people with no hospital. It's something leaders worry will happen to more rural communities.
Well, you see, today, Missouri leaders gathered to prepare for cuts to Medicaid. And KSHB 41's Elise Schoenig visited the town of Sweet Springs and its vacant hospital to share voices on the issue.
You can still see faded reminders of the hospital that closed years ago in Sweet Springs, Missouri. Now the town of 1,500 doesn't have any left. And as leaders in Missouri prepare for cuts to Medicaid, they say that rural hospitals in rural towns like this one will see the most impacts. It didn't take long to find Kathy Navarro in her small town of Sweet Springs, just an hour east of Kansas City.
For doctors, you would go out of town. We've got Concordia, Waverly, Marshall, Sedalia. If specialty, they'll send you on from there.
But that hour can be life or death when you lose your town's only hospital.
It is a loss. It is.
They still have an ambulance district, but the town's hospital before this one also shut down in the 90s. Bill Cook was on the board for that one.
Today, we're a town of 1,500 people. We have no doctors, we have no dentists, we have no hospitals.
According to the Kaiser Family Foundation, President Trump's budget bill will reduce federal Medicaid spending in rural areas by $137 billion over the next 10 years. The nonpartisan healthcare nonprofit estimates this will be a loss of $4.53 billion to rural areas in Missouri.
You start doing damage to Medicaid, you're going to do damage to rural hospitals.
U.S. Representative Emmanuel Cleaver says he remembers how the most recent hospital closure in Sweet Springs affected people.
We have at least 4 rural hospitals in Missouri that are at risk.
He wouldn't specify which hospitals are at risk or where. Kathy knows they'll keep looking out for each other in Sweet Springs.
With that comes the doctors. That comes the therapies, and we need a hospital.
And keep hoping for health care that opens doors. In Sweet Springs, Elise Schoenig, KSHB 41 News.